Hello viewers, I am Dr. Sangeeta Datta, consultant psychiatrist from Guwahati. This video is intended to increase awareness amongst the people about different psychological conditions and psychiatric disorders. Today we shall discuss briefly about a condition called schizophrenia or schizophrenia. Schizophrenia is one form of psychosis where a person gradually loses reality contact. In other words, the person gradually starts moving away from reality and entering a world of imagination. Therefore, in schizophrenia, we find hallucinations, which means that the person may hear voices which are not heard by others, which is called auditory hallucination. The person might feel the touch of someone or something when nothing is there, which is called tactile hallucination. The person may smell something when actually nothing is there to be smelled. That is called olfactory hallucination. The commonest is auditory hallucination or hearing of voices. A person who hears voices or has auditory hallucination may actually mutter to himself or talk to himself. Therefore, it is not uncommon for us to see a patient of schizophrenia muttering to himself, talking to himself, or smiling to himself. Apart from hallucinations, which are perceptual disorders, we also get certain thought disorders, formal thought disorders, in the form of delusions. Delusions are certain rigid thoughts and beliefs which cannot be removed from the mind of a patient suffering from schizophrenia or other forms of psychosis, despite giving logical explanations and trying to explain to the patient that this is not possible and this is not true. Nevertheless, the patient continues to believe in it and continues to be deluded. Some common forms of delusion found in schizophrenia are delusion of persecution, which means that a person suffering from schizophrenia would be suspicious and he would suspect that the whole world or some people in particular are conspiring against him. There can be delusion of reference, which means that the patient might think that people are talking about him from a distance, people are discussing him. There can be delusion of control, which means that the person might think that there is a supernatural power or extraordinary force which is controlling him. So there can be many other forms of delusion, but another form is delusion of spiritual grandiosity, which means that the person feels that he has some supernatural power which has been bestowed on him, upon him by God himself. Or sometimes the person might start believing that he is God himself. So there can be a delusion of infidelity, which means that a person becomes suspicious about his partner, which could be a husband or a wife or could be a boyfriend or a girlfriend, and might suspect him to be having an affair or illicit affair with somebody else when it is not the truth. I must mention here that even people who are into alcoholism, who are addicted to alcohol, can also become suspicious about their partners regarding loyalty. Schizophrenia can be of different types. The commonest that we find is paranoid schizophrenia, when there is fearfulness, suspiciousness, irrelevant talking, muttering to self, smiling to self, disturbed sleep, and if it remains untreated, gradually it will amount to self-neglect, lack of personal care, so on and so forth. Catatonic schizophrenia is a kind of schizophrenia where a person maintains different kinds of postures. Let's say he can lift up one leg and stand on one foot. He can actually sleep on the bed without putting his head on the pillow, and there will be a space between the pillow and his head. So these are symptoms of and signs of catatonic schizophrenia. There is another variety which is called heavy phrenic schizophrenia, which is usually found amongst adolescents. Its age of onset is relatively lesser. So there we also get some symptoms like fleeting delusions and hallucinations. In other words, delusions and hallucinations may not stay always, but it comes and it goes. might be mirror gazing, there might be very, very immature behavior on the part of this individual, or it can be a very disorganized form of schizophrenia where it's a mixture of everything, or it can be simple schizophrenia where the family members or the friends of a patient does not even realize that something is amiss, because the person's symptoms develop so silently, so slowly, that it takes almost a year or 2 years to understand that something is really amiss and the person has developed some psychological problem or disorder. Schizophrenia can be easily treated. We have a lot of medications, especially the newer generation antipsychotics, which come with a very good side effect profile. So we have to feed medicines to such patients. However, if schizophrenia has progressed to a stage where the person has lost reality contact altogether, the person will not believe that he's unwell and will refuse medicines. In such cases, we might have to admit such a patient in the hospital and give him injectables so that he comes to a stage where he agrees to take medicines and or he develops the insight that yes, something was wrong with him or is wrong with him and he needs treatment. Psychotherapy or counseling cannot be done in actively psychotic patients of schizophrenia because they have lost reality contact. However, family counseling is very important, psychoeducation is very important, and once the patient goes into partial remission and then into complete remission, even counseling is advisable so that the patient understands his condition and he continues taking medications as prescribed by a psychiatrist. Poor drug compliance or not taking medications on time can lead to relapse of symptoms. However, a person, when he listens to a psychiatrist's advice and continues taking medications so long he is advised to take medications, will actually get wonderful results out of the treatment. Sometimes there can be family history in schizophrenia, and sometimes there can be incidents or life events which have actually made the person become psychotic. It is not always necessary. It is a fact that if the time period between starting of treatment and the starting of the illness is very short, in other words, if you actually do not waste time and you take a person to a psychiatrist, a person who's supposedly suffering from schizophrenia or any other psychosis, to a psychiatrist without wasting time, then the prognosis or the outcome is much better than actually taking him after years of onset of the illness, because already some damage is done. There are some superstitions and myths about schizophrenia and many other psychotic problems in psychiatry. Superstitions like it is caused by a sin, or it can be treated by a faith healer, so on and so forth. We need to raise awareness about mental illness and understand that it is a biological issue with psychological and social aspects to it, and we need treatment with medications and perhaps counseling later. Family support is very important. Drug compliance is very important. And then even a person who has developed schizophrenia can live a very fruitful and meaningful life, and a large section of them would actually recover. So I hope you all have understood what schizophrenia is. So next time when you see a person showing odd behavior or talking to himself or smiling to himself, please do not waste time and take him to a psychiatrist. Start treatment immediately. You'll get wonderful results. Please do not forget to like this video or subscribe this video. Till we meet next time with a very interesting topic once again, goodbye and take care.